Welcome back. Now, police data reported that 483 suicide cases were in the last 3 months, an indication that the avalanche of mental disorders has hit. Now, tonight we talked to the longest-serving psychiatrist in Kenya, it's safe to say, Dr. Frank Njenga, who is also the chairman of the Chiromo Hospital Group, to get insights on what's fueling the spike in suicide cases and just where we are in terms of the current state of mental health in the country. Dr. Njenga, thank you so much for joining me this evening. Let me first get your take on what's happening now. When I last spoke to you, which was about a month ago, you said we're getting ready for an avalanche of mental disorders as a result of last year's pandemic. Is that what we're seeing now?
I think in part that is what is going on. On the 15th of May last year, the World Health Organization issued a warning to the whole world saying that following the rapid increase in the cases of the coronavirus, a wave of mental health concerns would arise, and these would include diabetes, schizophrenia, all sorts of mental health needs would increase, and they have indeed increased. And I think the most recent increase in suicides can be attributed to this challenge.
Right. When we look closer at those suicide stats, just in general, men tend to commit suicide 3 times more than women do. What could be contributing to that?
This is a global figure. Men die by suicide much more often than women. But in fact, if you look at the number of people who attempt to die by suicide, women are 3 or 4 times more common in this attempt. So men, if you like, are more efficient in killing themselves, women less so. But even in Kenya, if you look at Kenya, men die by suicide 2 or 3 times more often than women. So although women try more often, men die much more frequently.
Let's take a look at the mental health report that was released from your task force. I believe it was last year. And you mentioned how when you talk to different communities across this country, people were aware that there is a huge mental health burden in Kenya. But does that translate now to people actually getting help, going to a hospital, going to a clinic, going to see a specialist, an expert to help them process what it is that they're going through?
Clearly, yes. And I think that's a good thing. The corona is a terrible thing because it has caused many, many, many deaths. Corona has caused a great deal of human suffering in terms of the economy, in terms of the stress and strain it has caused on individuals. But I think it's also had the silver lining of increasing awareness about and around mental health. And we are seeing, certainly amongst the younger people, more and more people going out, Googling and coming to mental health facilities to say, I think I have depression, I think I have schizophrenia, I think I have ADHD. So the silver lining to corona is that more and more people are more aware and are seeking treatment.
And just to kind of put a face to those individuals who will be going to Google or trying to research what it is that they're going through, these are people who are probably exposed. If you're talking about someone who's living in a low-income area, mashinani, they're not inclined to do that. They may be going through the symptoms but don't understand what it is they're going through. How are they helped where they are?
In 2 ways. The first way is the fact that government over the last 10 years has had the opportunity of training and educating primary healthcare workers, including clinical officers, in large numbers. I think there is no clinical officer or nurse who goes, for example, through KMTC without being exposed to a mental health curriculum. That has been going on for the last 10 years. Unknown to many people. So that's one way. So when you go to a health center and you're complaining of I can't sleep, I feel tired, I feel sad, the clinical officer or the nurse at the primary healthcare level is able to make the correct diagnosis and treat you or refer you appropriately. That's one way. The other way is that there has been a mushroom of organizations at the primary health, at the community level, who are able to give education to communities, and there are many, and they're effective. And because they have access to modern technology, lots and lots of people in the community are now recognizing that lack of sleep, feeling tiredness, being irritable, not being able to look after your children in the way that you'd like to, are all features of a mental health need. So the message is getting across. It's slow, but it's getting there.
And talking about how we progress or accelerate this need to increase perhaps mental health facilities across the country, or just mental health help in general, is funding. There's a huge funding gap here in Kenya, and the report raised that quite significantly. I mean, just talk about how little we are spending when it comes to mental health care in this country.
The global standard of a good expenditure for mental health is on the average 250 shillings per person per annum. We are spending about 15 cents. 15 cents, I don't think 15 cents can buy even a sweet. That's how much we in Kenya are spending in mental health. Now, so that's the downside. This is what our report, the Mental Health Task Force, reported. I think on the positive side is that government has acknowledged, has accepted the findings of the report, and we are currently, right now as we speak, in the process of preparing something called the Mental Health Economic Case, which is a case that is developed by government, the World Health Organization, UNDP, and so on, to actually justify why it is important that all government, and in particular the Kenya government, should invest in mental health. For example, and very quickly, we already know, even without this investment case, that 1 shilling invested in an adolescent gives a return of 20 shillings in a very short period of time. So in anticipation of the findings of the investment case, we expect that Parliament will be able to allocate more funding to mental health, because it really does make a lot of sense to invest, particularly in young men and women in our country. The returns are unbelievably big.
And before I let you go, Dr. Njenga, I just want to get your take on moving forward. You talked about a very encouraging trend of young people coming and saying, you know, I looked this up, I think I have this, and there's more interest in their own mental health care. But you're also very aware that we're living in a society where we are notorious for self-diagnosis and self-medication, you know, which will also increase stigma. If someone feels, I don't want to be seen to be going to a mental health facility or seeing an expert, let me just deal with this behind closed doors. How do we deal with stigma effectively in that context?
Let me start with the bad news. Suicide rates the world over are highest amongst my professional colleagues, doctors. The suicide rates amongst doctors are more than twice the rate in the general public. And that sad reality is driven by exactly what you say, the stigma of being both a doctor and having a mental health need. So that's the bad news. The good news is that the youth who form the bulk of our population don't seem to have as much of a stigma or stigmatizing process as their parents. And therefore, if one is inclined, as I am, to look into the future is getting brighter. And I have to say this also, Victoria, with your permission, that the media in our country has done two things. One is that it has allowed itself to be informed better on how to report on mental health. I think unlike most other countries in Africa, our media in Kenya has allowed itself access to mental health information, and I think this is a good thing. The second thing, which I think is critically important, is that we have taken a long-term view. I don't think there's anybody in our country who thinks that there's one quick fix to the problem of a stigma. So we are long-distance runners, believe it or not. Even in Tokyo, we are long-distance runners, and I think that is the correct approach. Let us not look for a quick fix. Let us put in place long-term strategies that will help us normalize conversations about and around mental health.
Dr. Njenga, thank you so much for your time. Always a pleasure getting your insights on what's happening in the country when it comes to mental health. On that note, let's take a short break here on Citizen Week.